If you're afraid that you might have a panic attack once you sit down in the dental chair, I want you to understand something that can completely change the way you approach your next appointment. For many people, the biggest fear is not actually the dental procedure itself. It is the thought of feeling trapped, losing control, or suddenly becoming overwhelmed and not knowing what to do next. My name is Dr. Sanchez from Miami Dental Sedation Spa, and for over 20 years, I have helped thousands of patients break away from fear or stress and get a beautiful and healthy smile. I hear versions of the same question all the time. Doctor, what if my heart starts racing? What if I feel like I cannot breathe normal? What if I suddenly need to get out of the chair? What happens if I panic after you have already started? Those are important questions because when somebody has been dealing with dental anxiety for a long time, the fear can begin long before the appointment. You might be thinking about it days in advance. You might lose sleep the night before. You might sit in the parking lot trying to convince yourself to walk inside. Or you might cancel the appointment because avoiding it gives you immediate relief. The problem is that this can create a cycle. You feel anxious. You avoid the dentist. Avoiding the appointment makes you feel better for a little while, so your brain starts associating staying away with feeling safe. Then the next appointment can feel even more intimidating. Meanwhile, if there is a dental problem that needs attention, it may continue progressing while you wait, which can sometimes mean more involved treatment later. Now there is more fear, more uncertainty, and even more reason to keep delaying. That is why I do not believe the answer is simply telling somebody, relax, we need a plan. The first part of that plan is understanding exactly what makes you anxious. Maybe you're afraid of needles. Maybe it is the sound of the dental equipment. Maybe you do not like to be reclined. Maybe you had a bad dental experience years ago and you still remember how powerless you felt. Or maybe the biggest issue is simply not knowing what is going to happen from one moment to the next. When we know what the trigger is, we can talk about it before treatment begins, instead of waiting until you're already overwhelmed. We can also establish a clear stop signal. That might be something as simple as raising your hand. The point is that you know before we begin that you have a way to communicate with us if you need a pause. That can make a meaningful difference because one of the strongest drivers of panic is the feeling that you have no control. If you know what is happening, you know how to communicate, and you know there is already a plan for what happens if your anxiety rises, you are approaching the appointment very differently. For patients who need additional support, we also offer sedation through laughing gas, also known as nitrous oxide, at no cost to you. Nitrous oxide can be one option to help certain patients feel calmer during dental treatments. Depending on your level of anxiety, your medical history, the treatment you need, and your individual circumstances, my team and I can also discuss other sedation options that may be appropriate for you. Sedation is not about making promises that you will feel absolutely nothing or remember absolutely nothing. It is about finding the right level of support for the individual patient and creating a treatment plan that helps make dental care more manageable. Now, even with a good plan, you may still be wondering, what happens if I feel panic starting anyways? The first thing is to communicate with us. Use the signal we already established. We can pause and give you a moment to reset instead of trying to mentally get through the entire appointment at once. Bring your attention back to what is happening right now. Slow your breathing, relax your shoulders, feel your feet, and listen to the instructions we're giving you. You already have a plan and you already know how to tell us what you need. I also want you to know that you do not have to be embarrassed about any of this. I have met patients who apologize before they even sit down because it has been years since their last dental visit. Some are embarrassed about the way their teeth look. Others are embarrassed because they think they should be able to handle the dentist without being afraid. My highly trained team and I are not there to judge you for what happened before you came to us. We're there to understand where you are today and figure out how to help you move forward. We can handle pretty much most areas of dentistry within our office, which allows us to coordinate your treatment and support you through the process instead of making you feel like you're trying to navigate everything by yourself. And I also know that your questions may go far beyond dental anxiety. Maybe you're wondering whether you need implants. Maybe you want to improve your smile with cosmetic dentistry. Maybe you're concerned about finances, how treatment works, how long it may take, what sedation options are available, or any other relevant question. That is exactly why we created an interactive experience at MiamiDentalSedationSpa.com. You can use it from home at your own pace to work through your doubts, fears, questions, and concerns before you ever decide to make an appointment. You can get to know our team better and explore information about dental implants, cosmetic dentistry, sedation, finances, treatment options, and anything else you may want to understand before taking the next step. For some people, that is a much easier place to begin. You do not have to start by sitting in the dental chair. You can start by getting answers. Share this video with a friend or family member who may be struggling with dental fear, and follow this account for more guidance on overcoming dental anxiety and making dental care more manageable. If you're ready to talk to us, call us 305-445-4646 or visit MiamiDentalSedationSpa.com. There, you can use our interactive experience, learn more about our team and your treatment options, or use our online scheduler to make an appointment at your convenience. The first step does not have to be forcing yourself through your fear. The first step can simply be understanding what is making you anxious, getting your questions answered, and creating a plan for how we're going to help you move forward.